in order to really support your teen with aftercare, immediately we're looking at, do they have an outpatient therapist that they're going to go to? Are they seeing a psychiatrist? Do they need medication? The hope is that if they do need meds, they're going to get stabilized while they're in this program. My name is Celina Serna. I am a program director and a licensed clinical social worker here at Clear Behavioral Health in Van Nuys. I have been working in an IOP level of care for about 4.5 years now. So most of my experience, most of my work in a clinical setting is with teens, with families. I do have experience working with adults as well in hospice care, medical social work, but the bulk of my experience is going to be with teens in an IOP level of care. What should you do if your child is experiencing a mental health crisis? First and foremost, you want to ensure that your teen is safe and they're in a safe environment. So a mental health crisis can mean many different things. Typically what I see at Clear Behavioral Health for teens that are coming in, there's some self-harm or there's some kind of substance use there where parents are really scared, they're worried about their well-being and their safety, and they're bringing them into our program. I would say if your teen is struggling with mental health crisis such as self-harm or substance use, first and foremost, again, you want to ensure safety, right? If you have a teen who is self-harming and they're cutting at home, or you see that they have some kind of self-harm scars, I would suggest locking up sharps in the home, making sure that there's no objects that they can use to cut themselves with is going to be your priority. The another thing that I suggest to parents as well is try to listen to your teen and ask questions without judgment. Get really curious and compassionate when asking them these questions, just so they know that they have support and that they're not being judged. When teens are in a place where they're self-harming or they're using substances to cope, they're really struggling emotionally, and the last thing that they need is judgment. Most times parents are scared and they're worried, so their questions come off a little critical, and it's really not helpful to your teen during that time. Another thing that I would suggest is that if the behaviors increase, or if your teen's wearing long sleeves or hoodies in the summertime and 100-degree weather and sweats, that might be a sign that they are trying to hide something. And if you notice that these behaviors increase, and again, it has to be something that's drastic and out of their baseline, then I would suggest seeking mental health professional help. Another thing that I would suggest, if your teen is continuing to struggle with crisis and it has escalated to a point where there is concern for their safety, you can utilize hotlines that are available in California. 988 is one that is most commonly used by clients and parents when needing to seek help for crisis management for suicide prevention. At an IOP level of care, the group support in the community is so powerful for the teens because they get to talk to other teens who are struggling with the same challenges or having common symptoms, so they don't feel alone and they're not judging themselves and feeling all this shame for what they're going through. They have an opportunity to connect to others and to really talk about what they're experiencing and what they're feeling. Here at Clear Behavioral Health, crisis management, crisis intervention, and safety planning is a huge part of what we do. It's embedded in the treatment that we provide here. So from the start of the treatment with the teen, we are immediately assessing for safety risk. We're immediately working on safety planning and really trying to help the teen create or identify a support system, support network that they have in their life. Community, again, is a big part of healing and going through this journey. So we really try to identify the community support, what their coping skills are, what are their warning signs, how do they know if they're going to go to a crisis, and we do that work immediately when they start the program. We offer a lot of hands-on support. So when we think about crisis intervention or stabilization, we are offering intensive services 5 days a week for the first 2 weeks the client admits into the program. program. They eventually do titrate to a 3-day schedule. But what we're seeing is that this teen is getting a lot of wraparound support to help them stabilize and reintegrate into the community to where they're able to function independently in a healthy way. So here at Clear, we really prep for discharge immediately. So when our clients are intaking that first week, we're really looking at who is our client going to go to when they are going to complete the program. So we're working with the parents, and I would say that for the best success, we want our clients to do outpatient therapy 2 weeks prior to completing the program. We do believe that at Clear, we're a 3-month program. So when they come and they're working with us, we're really trying to stabilize them to where they're able to function in their day-to-day life. However, there are a lot of other things that the teen may be going through that they need to work on in long-term treatment. So I would suggest, in order to really support your teen with aftercare, immediately we're looking at, do they have an outpatient therapist that they're going to go to? Are they seeing a psychiatrist? Do they need medication? The hope is that if they do need meds, they're going to get stabilized while they're in this program. Another thing that I want to see is, do they need a doctor's appointment? What does their physical health look like? Most times, physical health can impact mental health, and if we're seeing that through the course of treatment, we really do encourage the parents to take action and get them into a medical doctor if necessary.